Chronic kidney disease, or CKD, affects millions of people around the world. It's marked by a slow but progressive loss of kidney function. As the kidneys deteriorate, they fail to effectively remove waste and excess fluids. This leads to severe health complications such as high blood pressure, anemia, weakened bones, deteriorating nutritional health, and nerve damage. Additionally, CKD notably increases the risk of developing cardiovascular diseases. Given the extensive prevalence of CKD, its profound impact on individuals' quality of life, and the significant economic burden it places on healthcare systems globally, there is a pressing need for more effective management and treatment strategies. Intriguingly, sodium bicarbonate, a simple compound commonly found in household kitchens, may offer a ray of hope in this ongoing battle against CKD. It suggests a potential method to slow the progression of this debilitating disease. One might wonder if the solution to managing this relentless disease could indeed be found in plain sight within the confines of one's own kitchen pantry. In our exploration today, we delve into the potential role of sodium bicarbonate, better known as baking soda, as an unlikely ally in the fight against chronic kidney disease. This common kitchen ingredient, typically relegated to roles in baking or household cleaning, now emerges as a beacon of hope for those grappling with the challenges of kidney health. The kidneys are vital organs that play essential roles in filtering waste from the blood, regulating blood pressure, balancing electrolytes, and maintaining overall fluid balance, functions that are crucial for the body's proper operation. However, individuals diagnosed with chronic kidney disease encounter significant challenges as their kidneys gradually lose their ability to perform these essential tasks. As CKD progresses, it leads to an accumulation of toxins and fluids in the body, which causes a range of debilitating symptoms and increases the risk of further health complications. Chronic kidney disease progresses through 5 stages, characterized by a gradual decline in kidney function, categorized based on the rate at which the kidneys filter blood, known as the glomerular filtration rate, or GFR. These stages range from mild, which is stage 1, to complete kidney failure, which is stage 5, where dialysis or a kidney transplant becomes essential to sustain life. The progression of CKD is often asymptomatic, with many individuals unaware of their declining kidney function until the disease reaches an advanced stage. Common culprits behind CKD include diabetes and hypertension, conditions that are prevalent globally and known to inflict damage on the small blood vessels within the kidneys, impairing their filtering capabilities. Early detection and proactive management of these underlying conditions are crucial for slowing the progression of CKD and preserving kidney health. Metabolic acidosis is a frequent complication among patients with chronic kidney disease, particularly as the disease advances to its later stages. This condition arises when the kidneys can no longer efficiently excrete sufficient acid or conserve adequate bicarbonate, leading to an imbalance that results in overly acidic blood. The prevalence of metabolic acidosis increases with the severity of CKD, affecting a significant proportion of individuals in the advanced stages of the disease. Sodium bicarbonate, commonly known as baking soda, is a white crystalline powder that is naturally alkaline or basic. It's widely utilized in baking as a leavening agent, where it reacts with acidic components to produce carbon dioxide gas, facilitating the rise of dough. Beyond its culinary uses, sodium bicarbonate is employed for its cleaning properties, neutralizing odors, and in certain medical applications due to its ability to buffer or neutralize acids in the human body. Research has shown that sodium bicarbonate supplementation can have beneficial effects for CKD patients, particularly in slowing the progression of the disease and improving metabolic acidosis. Studies indicate that oral sodium bicarbonate can help elevate blood bicarbonate levels to within a normal range, thereby reducing the acid load on the kidneys and potentially delaying the need for dialysis. The concept of a kidney-saving soda emerges from the idea of formulating beverages with sodium bicarbonate to support kidney health, especially for individuals with chronic kidney disease, CKD. These specialized drinks are designed to offer a convenient and palatable way to consume sodium bicarbonate, leveraging its potential to slow the progression of CKD and combat metabolic acidosis, a common complication in patients with declining kidney function. The potential benefits of such beverages stem from sodium bicarbonate's role in neutralizing excess acids in the body, thus helping to maintain a healthy pH balance. However, there are limitations and considerations to bear in mind. The efficacy and safety of sodium bicarbonate, whether through sodas or supplements, can vary depending on the individual's overall health status, stage of chronic kidney disease, and presence of other conditions, such as hypertension or heart disease, which may be exacerbated by excessive sodium intake. Furthermore, the long-term effects of consuming high amounts of sodium bicarbonate are not fully understood, and there is a risk of alkalosis, a condition where the body becomes too alkaline if taken in excessive amounts. For patients managing chronic kidney disease, a balanced diet plays a critical role in slowing disease progression and maintaining overall health. General dietary tips for CKD patients often include limiting protein intake, in addition to dietary adjustments, several lifestyle modifications can support kidney health and help manage chronic kidney disease, or CKD. Proper hydration is crucial. However, the amount of fluid intake should be tailored to individual needs, especially in advanced CKD, where fluid restrictions may be necessary to prevent fluid overload. Beyond dietary sodium bicarbonate, CKD patients might be recommended other supplements or medications to address specific needs or complications associated with the disease. Phosphate binders help control high phosphorus levels in the blood, preventing bone disease and cardiovascular issues. Sodium bicarbonate, commonly known as baking soda, has emerged as a potentially kidney-saving component for individuals managing chronic kidney disease, or CKD. Its primary benefit lies in its ability to neutralize excess acids in the body, offering a simple yet effective means to combat metabolic acidosis, a common complication in CKD. Scientific studies support the use of sodium bicarbonate in slowing the progression of CKD, improving metabolic acidosis, and potentially delaying the onset of dialysis by helping maintain a healthy pH balance in the body. Despite these benefits, it's crucial to approach the use of sodium bicarbonate with caution. We invite you to engage with this topic further by liking, sharing, and commenting below with your thoughts or experiences regarding sodium bicarbonate and kidney health. Your insights could be invaluable to others navigating similar challenges, and together we can foster a supportive community focused on kidney health and well-being.